Dr. Mullen name is synonymous with both the New England College of Optometry and with the Veterans Administration. He was a graduate of the New England College of Optometry, became clinic director very early on, and set up the network of community health centers, which is one of the pillars that the New England College of Optometry is proud of in our clinical system. We have two strengths in our clinical system that envied by every other school. One is the depth and the breadth of our VA affiliations, and the other is the extensive network of community health centers that exists for our students. And Charlie was the architect of doing that, and it didn't come easy. He fought against the local practitioners' reticence to have teaching clinics in the neighborhood, had to create the underpinnings for it to exist. And then in 1976, he was the executive director of the Eye Institute. Charlie was ex-military. He's a former executive officer on a destroyer, I think, or didn't get that far. Charlie wasn't very good. Charlie was very organized. Anyone who has worked with him knows that he looks at systems and not individual actions. And what happened when he left the Eye Institute, was recruited to the VA, he took what Ken had put together from scratch and built an organization that needed to have structure put in it so that it could get to the next level. And Charlie put in clinical privileges, Charlie put in networks of promotion, systems of promotions that were there, and became a very successful and short part of the VA system. Following his tenure with the VA, Charlie was elected the president of the Illinois College of Optometry, and now is quasi-retired. I think he's probably doing more advisory work in many fields than most people, but it's a testimony to the fact that he's been active and successful in so many parts of the profession. Dr. Charles Mullen.
For your gracious remarks. I'm deeply honored to be awarded the New England College of Optometry's Presidential Medal in recognition of my service as Director of the VA Optometry Service. It's also a distinct privilege to join my distinguished colleagues, Drs. Myers and Hackman, in receiving these tribute to the VA Optometry Service. As an educator, I'm grateful to the VA for its enormous contribution to the clinical training of optometry students and residents. And as a veteran, I'm most appreciative of the excellent eye care VA optometrists provide each year to over 1 million of our most deserving citizens, our nation's veterans. The comprehensive eye care provided to veterans by VA optometrists in collaboration with ophthalmologists is clearly among the best in the United States. Optometry clinics are among the busiest VA services, providing 1.5 million eye care visits annually. The VA Optometry Service was the first in the country to develop and implement an effective model of interdisciplinary eye care in a large national system. VA optometrists lead the profession in the management of patients with age-related macular degeneration, diabetic retinopathy, and glaucoma. Prestigious professional journals are replete with publications by VA optometrists affirming VA's leadership in advancing ophthalmic care. During my tenure as director, I witnessed the growing importance of VA optometry in the provision of primary eye care and low vision rehabilitation services. However, my experience pales in comparison to the dramatic increase over the past 12 years in optometry staff, students, and residents, including numerous quality improvement initiatives. The VA's Eye Care Quality Improvement Program is recognized as one of the most comprehensive and effective in healthcare. It is a unique system of checks and balances. For overall guidance, the VA adopted clinical practice guidelines of the American Optometry Association and the American Academy of Ophthalmology, the recognized standards for both professions. The VA's clinical credentialing and privileging process is precise and meticulously applied, ensuring that every clinician's education, clinical training, and licensure are appropriate for the clinical privileges granted. A robust system of clinical reviews, practice evaluation, and peer review programs ensure that every veteran receives the highest quality eye care. The quality, timeliness, and seamless provision of eye care services provided by 675 VA optometrists and over 175 residents and fellows is often cited as the gold standard for optometric care. In addition to primary eye care, optometrists provide rehabilitative care and VA special programs, such as low vision clinics, Victor's programs, and blind rehabilitation centers. 65 additional low vision optometric specialists have been appointed in recent years, and placement of mid-level and advanced low vision programs in each of the 21 VA integrated service networks is planned. The Department of Defense VA Center of Excellence is an outstanding program for the management of servicemen and women who have sustained significant eye injuries as well as vision problems resulting from traumatic brain injury. At this center, optometrists, ophthalmologists, and rehabilitation specialists ensure seamless transition for the patient from military service to the VA. The innovative Boston VA-based coloretinal imaging program has already assessed 700,000 veterans with the risk of vision-threatening disorders. Another example of optometry's leadership and effective collaboration among eye care providers, primary care physicians, and IT personnel. Special note of acknowledgement to my VA colleagues for your commitment to excellence in eye care and for your dedicated service to our nation's veterans. Thank you for recognizing my service as director. It was an honor to have served with so many outstanding optometrists. Thank you.